Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. In the rural setting, 70% of hospital pharmacies do not provide 24/7 coverage. Regulatory requirements and increased adoption of meaningful use technology have increased the demand on pharmacist support. Remote pharmacy services are a cost-effective way to increase the safety and quality of patient care. Today I'm joined by Rich Stomackin, Director of Pharmacy at Geisinger Lewistown Hospital in Pennsylvania, to discuss remotely delivering pharmacist care in small and rural settings. Welcome, Rich, and thanks for joining us today.
Thank you. I'm glad to be here.
There's still somewhat of a pharmacist shortage nationally. How are you supplementing pharmacy services in your organization?
Well, currently at our organization, we use a remote pharmacy order entry system to cover our evening shift. Recently, the Geisinger Health System, we became part of that, and the future of our remote services, we'll have to discuss how that's going to be handled. But in order for us to continue to provide services for computerized physician order entry, providing medication and information that goes on the electronic medication administration record, being able to remotely review the orders. We rely on a telepharmacy service because of our really just where we are physically located in the state. The supply, as you mentioned, is getting better because there are a lot more pharmacists that are graduating. When we first became involved in our remote order entry service contracts, we were running on the tail end of the 2000 mandatory PharmD degree. There was a huge growth in retail pharmacy business from people who never were in the business before. So the shortages required us to really look outside of our own staff and also outside of the state because we really didn't have the resources at that point.
When you were looking at alternatives, what was available to you and what were some of the criteria that you used to select your current service?
Well, when we got involved with remote order entry, we were at a point where order entry services from that perspective was really in its infancy. There are a lot more companies around now, but that doesn't mean that they can service your state or your facility. You have to really take into consideration where you're located, what the regulations are concerning, how does your state board allow whether they need to be located within the state, whether they can be licensed, they must be licensed in your state. So when we first started, there were really only two companies. One was in Maryland, one was in Ohio. And the criteria that I used had to deal with the types of services that they had and the way that they were based. One was a home-based, where pharmacists are working remotely from the house. Another was an actual licensed pharmacy that had a staff of pharmacists and technicians. So that, to me, made a lot more sense. And in addition to that, that company at that point was one of the two that was licensed in Pennsylvania, and they could fill pharmacy orders for us. And, you know, you want to take a look at a lot of these things in the case of what will happen if their service would go down. Can they shift things around? What do they do as far as training their personnel, maintaining competencies, having means that they can communicate with you for that handoff between your staff and theirs? What kind of reports do they give you to generate so you can show and prove the quality that you're getting? And also, as a pharmacy director these days, you're required by regulation to really review all your contracts.
But there is a learning curve involved.
There's definitely a learning curve. And you need to work at making sure that there isn't the us and them kind of atmosphere and philosophy that's going on. That has to be really driven into your own staff also to make sure that they incorporate telepharmacy as part of the whole pharmacy department. And you see it as a whole delivery of pharmacy services.
When you're hardwiring the pharmacist input into some of these electronic systems, how does that change the workflow of some of the other clinicians that may not be used to really having that input there?
Most small rural hospitals are centralized, and we struggle with trying to get the workflow to go to the bedside. Now, you mentioned automation, you mentioned technology. With the wireless technology that we have now, the ability to do orders anywhere within the facility, utilizing automated dispensing cabinetry to make sure medications are down by the bedside or down at the point of care for services for people to retrieve, your narcotics, etc. That can facilitate the ability for a small staff to get out. And that's something that I think most people right now are trying to work into their flow. And that's where remote pharmacy services sometimes will help, where if you really can't meet some of those things, they could be in the queue filling those orders so that when you need to go on a round, or you need to be at a floor at the round with the docs and the nurses, etc., and the other healthcare team, you got time. Because otherwise, the orders start backing up, and now people say, hey, you're jeopardizing these things because you're doing rounds. So trying to blend that together, that's a challenge. But I can see the utilization of remote services to help a rural hospital be able to meet that.
Thanks for joining us today.
It's been a pleasure. Thank you.